What are the contributions of Babasaheb Ambedkar? Yes, today we are going to talk about contributions done by Babasaheb Ambedkar, also known as Dr. B.R. Ambedkar. So, my name is Dr. Nitin, and on this channel, I share various tips, tutorial ideas, strategies related to healthcare businesses. And today we are going to talk about the contributions of Dr. B.R. Ambedkar. So if you are new to this channel, please subscribe to this channel. So let's get started with today's topic. I was going through Dr. Babasaheb Ambedkar's material, whatever he has written, and he is popularly known for his work for lower caste and depressed classes in India. But while going through his work and his contribution in healthcare, I was so much shocked that I thought to share those contributions with you so that you also realize that calling him a leader of Dalits is very unfair for him because the contributions that he has made for Indian healthcare and especially for women classes is tremendous, which I personally think nobody has ever done for women. So, without further delay, let's get started with today's topic. And let me share my screen. So, let's talk about his contribution with water. So, we like take the water as a day-to-day commodity, but it was not the scenario you uh, maybe 100 years back. It was not even accessible. Even in today also, uh, very it's not easily available and not. It is taken as a commodity, but it was not the scenario few years back. It was Dr. B.R. Ambedkar who has made water as a fundamental right under Article 21 of Indian Constitution. So, based on making this article itself, which has led to multiple laws and legislations in India, the Water Prevention and Control of Pollution Act of 1974 is based on Article 21. The, the Right to Information Act 2005 provides rights to know about the quality and quantity of water supply. You can ask this question to any government or body through this act. There is another act, National Rural Drinking Water Program 2009, National Urban Drinking Water Supply Program, the National Water Policy of 2012, then Atal Mission of Rejuvenation and Urban Transformation, also known as Amrit 2015, and the Jal Jeevan Mission 2019. So all these laws and legislations and programs, these are based on this Article 21 of the Indian Constitution, uh, in which Dr. B.R. Ambedkar had made water as a fundamental right. We are taking these things as a very much common thing, but we need to understand from where this is coming. It was not the scenario in the past, and because of his vision, we are able to enjoy that water today. So it was not just a fight or satyagraha for lower caste people. He has made legal provisions for upper caste also. Then his another contribution is into labor and employees area, where he had made provisions for appointment of a board of health and welfare of labor in convenience areas with power to make regulations related to drinking water, sanitation, drainage, medical facilities, and housing. So the medical and other benefits, sanitation and other benefits which we are enjoying today under labor law, those are provided by Dr. B.R. Ambedkar. He had made provisions for healthcare and maternity leave for women workers that was done under the maternity bill in 1928. Yes, my dear ladies friends, my ladies doctors, the benefits that you are enjoying, if you are enjoying government or private sector, and if you are enjoying those maternity benefits, those benefits are given to you by Dr. B.R. Ambedkar. Then he made another provision in Social Security legislation in 1948, under which the Employees State Insurance Corporation 1952 was established. And because of that, as an employee, uh, we enjoy the benefits of ESI insurance and the hospitals. So definitely that's a very like, huge population which is enjoying this kind of maternity and employees and insurance benefits. This is thanks to Dr. B.R. Ambedkar, who has made contributions and his power, you know, as a labor minister. Then another area of contribution is into uh, conceptualizing the public goods concept, under which he made provisions for health, education, food security, and corporate social responsibility, what probably we today know as a CSR, which is based on the Companies Act of 2013. So this is conceptualized by Dr. B.R. Ambedkar under the concept of public goods. Uh, there is another big area of contribution in family planning. Uh, Family planning is something which we take for granted today when we know the importance of family planning. But he presented that birth control bill in 1938. Unfortunately, it was not passed by the government, but if we were not fortunate enough, that's our bad luck. If that bill was passed in 1938, definitely the problems that we are facing due to increased population, we might not be facing today. And the population should have been under control. But it's our bad luck. We could not see the vision or we did not had the vision like Dr. Babasaheb Ambedkar had. But nevertheless, we have not now understand the importance of the family planning and the population control, especially if you are a healthcare practitioner. So he had made significant contributions to women, and he is the one who has shaped the feminist movement long time back, even when women were not even aware and they were not fighting for their own rights. So what contributions he had done is he made provisions for socio-cultural and economic rights. He had made provisions for right to property. He has made provisions for right to involvement in political processes, orders of successions, maintenance, what maybe we properly known as the Purvi in some local language uh, after the divorce, uh, and the marriage, the divorce laws, and the prescription of he has made uh, prescription of monogamy. Because of this, we see the the current state of affairs related to marriages. But unfortunately, we are losing that control in spite of various laws and regulations. Dr. B.R. Ambedkar made provisions for child marriage and prostitution and devdasi system. He was against it, and he made provisions legally so that this bad habits or cultural habits are not happening currently. He had made provisions for voting rights for women, which women were denied it from the voting, which was unfortunately their basic right, but they were denied of it. He made all these provisions under Article 15, which empowers state to make provision positive discrimination, like in favor of women and children. So that's under Article 15(3). And in Article 51A, he posed this as a fundamental duty of every citizen for women's safety. Okay, so if women are feeling safe today, that is because of Dr. B.R. Ambedkar. He had made for legal provisions of women reservation. People always talk Dr. Ambedkar about reservation for lower castes, but he did not just make reservations for lower castes, but he made other provisions for other weaker sections like scheduled tribes and other backward classes. And along with that, he had made provisions for a woman also. He had made provisions for women reservations under Article 243D3 to Article 243T3 and Article 243T4. So, because of this, women are enjoying the reservations today. And not only that, he made provisions under Section 14 of the Hindu Succession Act of 1956. So, those are the some of the contributions that I can find out for women uh, done by Dr. B.R. Ambedkar. And another significant area that I want to cover today is that the health segment, which is a very fundamental and basic right of every citizen, and we are taking it for granted, but it has been provided to us by Dr. B.R. Ambedkar in a legal context. So, Article 14 guarantees that state shall not deny any person equality before the law and the equal protection of the law within the territory of India. Article 15 prohibits any discriminations against in like religion, race, caste, gender, or the place of your birth. Then he had made provisions under Article 16 for equality of opportunities in the employment. Because of this, you get equal opportunity in any employment, irrespective of your background. Then Article 23 prohibits trafficking of human beings and forced labor, which is a very big problem currently because of this organ trafficking, human trafficking. But the legal provision is provided in the Constitution of Law by Dr. B.R. Ambedkar. Now it's a matter of the implementation, which controlled by the government. And then he provided Article 42, which is basically which says that the primary responsibility of the state to protect the health of infant and his or her mother. Uh, so he made provisions by giving the maternity and pregnancy benefits to the woman. So he has taken care of this infant health and pregnant woman care uh, under Article 42 under the Constitution of India. Then Article 21 of the Constitution guarantees the protection of life. So that is another very big area uh, provided by Dr. B.R. Ambedkar. And then Article 47 states that it's the duty of state to raise the level of nutrition and the standard of living of its people. So, my dear friends, can you see the kind of granularity and the thought process Dr. B.R. Ambedkar has given, even up to the level of nutrition, maternity benefit, pregnancy benefits. So, all these kind of benefits are provided uh, because of Dr. B.R. Ambedkar and his struggle to pass this amendment by fighting with the other members of legislative council, and because of his efforts and his consistency, those bills and the rights were passed and protected by under the Constitution of India, and based on this, various laws and regulations has been designed till date today, and which we are enjoying the benefits. But we are not aware about his contribution. So because we take uh, these are easily available for us, and that's why we are taking it for granted. So these are the few of the things which I could figure out. So I request you to I have two requests for you. One is share this video as many as with as many as people possible, so that people know about the contributions of Dr. B.R. Ambedkar in apart from so-called his contribution to lower castes. So he has made significant contributions to in healthcare. So if you are from healthcare background, if you're a healthcare professional, please do share with your healthcare friends so that they are also aware about this kind of contributions. And the second request that I want to make to you is that if you feel that this video has helped you, please give me a like so that I get motivation and I can create more and more tutorials like this. And if you feel this video is useful in information, I still feel that there are many more contributions which I may not be able to figure out, or I couldn't find. So I request you to, if you are aware about such contributions by Dr. B.R. Ambedkar, please mention those contributions in the comment sections. What do you think in what all aspects he has done the contributions? So please share that, particularly if those are related to healthcare and wellness of individuals of the India. So please share in the comment sections, and please share this video with your friends. If you are not subscribed, please subscribe to this channel where I share various tips, tutorials, strategies, ideas related to healthcare and wellness business. So that's all for now. We'll meet you again with another story. Till then, Dr. Nitin signing out.